As I mentioned, your ability to digest effectively decreases when you're pregnant, largely due to the pregnancy hormones. And so for some people, this can cause constipation. You might not have ever experienced constipation in your entire life, and suddenly you're finding yourself constipated while you're pregnant. You don't want to be constipated. For one, being constipated and straining on the toilet can lead to hemorrhoids, and that can be a big problem, especially later in pregnancy. There are some really great things that you can do to prevent constipation. One of the main reasons that people become constipated is due to lack of fiber in their diet. So if you're following, healthy pregnancy diet and getting lots of green leafy vegetables and drinking plenty of water, you should do okay. If you're still having trouble despite drinking plenty of water and eating plenty of green vegetables, and getting, so that you're getting plenty of, as well as, servings of whole fruit to ensure you're getting fiber from the fruit. Also, you're getting some daily exercise, so you're helping move, food through your bowels to prevent it, because not getting enough movement can also cause constipation. If you're doing all of those things and you're still finding that you're straining while going to the bathroom, then we'd suggest a sneaky little secret that actually solves two problems, and that is, we would suggest that you mix together psyllium fiber, so like maybe an eighth to a quarter of a cup of psyllium fiber, in with some unsweetened organic cranberry juice and water. So a lot of doctors and OBs will recommend taking Metamucil while you're pregnant for the fiber, and we don't like to do that because of all the artificial flavorings and colors and sugar in Metamucil. The sugar-free one has artificial sweeteners you don't want to be having. The sugar-rified one has a ton of sugar in it. Simple sugars, it's going to cause other problems. What we found works a lot better is to create our own Metamucil type drink. And so really we would use 8 to 16 ounces of water, and just in a shaker bottle, or you can put it in a blender or what have you, and we would add to that about a quarter of a cup of unsweetened organic cranberry juice. What's wonderful about cranberry juice is a ton of vitamin C in it, and it's one of the very best things for preventing urinary tract infections and bladder infections. And since you're at increased risk for urinary tract infections while you're pregnant, this actually solves two problems all at the same time. And then to that we add between an eighth to a quarter of a cup of psyllium fiber, just regular raw psyllium fiber. And because it's heavily sprayed, you really want to make sure that you're getting organic psyllium fiber. That's another reason for not using Metamucil. Of course, the psyllium husks in Metamucil are not organic. So use, like, Gia Foods has an excellent organic psyllium fiber. Use that. And so we just have that once or twice a day, first thing in the morning, last thing at night. If you're having trouble getting enough protein, we've actually added that to protein powder. So a nice source of raw whey protein, the vegan protein sources, you can add that. Dr. Mercola has a couple of protein, it's available online, that's why I bring it up, but they have a vegan protein powder, which is great if you're lactose intolerant or having trouble with dairy. Whey protein is probably the very best type of protein. It's most absorbable, it's easy to absorb, so that's great when you're pregnant. But if you're lactose intolerant or allergic to milk at all, then the Mercola's vegan protein is also a wonderful one, and that can give you your protein at the same time that you're getting the vitamin C and cranberry juice to prevent the urinary tract infections and the fiber.